Okay, doing a little update. So we're getting real close to being in the hospital. October 16, having a bad hair day, so I'll put on a do-rag. They tell me I won't have a bad hair day very long, much longer. So I got the official schedule from the coordinator. I get the Hickman catheter on the 15th of October. And then we're doing the 16th of October will be admission to the hospital. Then we get a week of chemo, and they decided to do 1 day of radiation, whole body radiation. So, I was kind of caught me blindsided when they first said it, and I said, so they called and explained it. So the radiation, it's low dose, they said. He said it was insignificant, and I was thinking to myself, well, if it's insignificant, why are we even doing it? But it's a big enough dose that it will do something. So what it is supposed to do, it is supposed to reduce the percentage factor of this AML, whatever it is, myelodysplastic syndrome, from coming back. Also, it is supposed to reduce the chances of me having rejection issues from my donor. Like I said, the donor is a 30-year-old white guy from Germany somewhere. So I'll get to Hickman, go in the hospital the next day. They start chemo. I get radiation. Then they start this stem cells on the 23rd of October. This all happens between 16 and 23. And then the waiting, babysitting time, hoping that my numbers start climbing up, start doing what they're supposed to do. Providing there's no fever, no major issues, diarrhea, whatever, bleeding, then I get to go home to my home, not sitting on campus somewhere. They agreed to that, because the big thing was how far away I was, and it's less than 50 miles. When I mapped it out, takes like 35-40 minutes with no traffic, tops, depending on how you go. And actually going the back way to get to the interstate is actually faster. So we've only got about a 35-40 minute ride in case I have to go back to the hospital for fever or any other kind of complications that cannot be controlled at home. With that being said, it's getting really close, and I think I'm gonna go ahead and skin my head. I would really like, if there's any cancer patients out there that actually see this and are watching my video, throw out some comments. I'd like to know what y'all think. You know, I really don't want to be sitting up at the hospital and my hair start falling out, and I don't have a buzzer to take it out with. Now, a friend of mine that went through chemo and radiation, like regular, he had a thing that you know, regular radiation and regular chemo. Anyway, he said his beard thinned but did not fall out. So I started letting my hair grow back. Started letting my beard grow back. So we've got, today's the 20th, basically a month. And we'll see how this looks in a month. But yeah, throw some comments out about what you think. I thought about getting a cool cap, try to preserve my hair. They say that you know, you put ice packs on your head, it keeps the chemo from getting to the ends of your whatever it is. Helps you keep your hair, but then I've seen, you know, it really, your hair will thin out. Mine's already thin. It's not thin in the back so much, but on top, all this is thin. So, you know, it's not like I'm losing a whole lot to begin with, but it'll come back. But yeah, throw your comments out. I'd like to know what y'all think. Also, one of my other coordinators told me about this thing, magic mouthwash. They said after about a week, the chemo will start making you have mouth sores and all this stuff, painful to swallow. Nobody ever told me the ins and outs about stuff like that. Well, it's got Mylanta or something, and it's got lidocaine as a painkiller. It's got some other stuff. I don't know exactly all what's in there, but it's for when you don't want to eat because it hurts. It hurts to swallow. It hurts to cough. There was one guy I saw on YouTube. He was talking about, he had throat cancer. I have like pre-leukemia, so it's not like they're isolating the chemo, the radiation to my throat or anything. But he said you didn't want to sneeze, you didn't want to cough. You know, it was so, the pain was so severe. But he was giving tips on how to avoid, you know, pain with throat cancer. But that's not what I have, so. But anyway, the magic mouthwash is supposed to help numb your mouth, the sores, all this stuff, and help you be able to eat. I'm hoping that, you know, I don't turn anorexic because I'm not eating or anything. They said at the hospital when I didn't feel like eating, they would give me big old banana bag and stuff. I was on keto diet for a while, and I lost like 50 pounds, and I was feeling pretty good. The wife told me, you're done with keto because, you know, they're gonna treat you with chemotherapy and all this kind of stuff. Well, I'm back up like 10 pounds from I'm back up to 200 from 190 just from, I've always had a weight problem. It's like I don't really overeat. It's just I don't know. It's just one of those things, It's like I've always kind of been a big boy. And the funny thing is, I was a preemie when I was born. I was born like a month and a half early. I was barely 7 pounds. And that's crazy, isn't it? But yeah, she told me I was done with keto because of all the stuff that we're fixing to go through. She said I needed to have some meat on my bones, something for it to take away from. But she's been great. I don't guess I've ever talked about her during this whole thing. We have been married 33 years. She is my third go-round. My first wife, we lasted about 4 years. Stuff happened. She passed away a couple of years ago. Don't really know what happened there. I don't think she really took care of herself very well. And they just found her. She had some comorbids. She had some medical issues. And the second wife, she's just crazy. So then I married this lady. Found her at a gas station. Picked her up at a gas station. So I was working, many years ago, I was working for Hank's Ambulance Service. Hank's, A&A, it's all the same. And I was driving the UAV critical care transport truck. And there's this gas station on Southside Birmingham. It used to be called Max One Stop or Quick Stop. And it's a Texaco. It was a Texaco forever. And then a couple of years back, they changed it to a Chevron, I think. Chevron bought it out. Well, I was sorta dating this girl, or trying to date this girl that was running the register. She's a hot blonde. No, redhead, sorry. Flaming red hair, that's what attracted me to her to begin with. And she had this really outgoing, very loud, bouncy personality. Yeah. So, that didn't play out, but I knew the girl because I stopped in there and I bought gas all the time. And then I was just happened to be driving by and I saw Connie in there talking to it. She was standing at the counter, standing there talking to her, and I drove around the block, came back in, got gas, and I went in there the only reason I went in there was to talk to her. And back then, all we had was pagers, so I gave her my pager number. Well, about 2 weeks later, she finally called me, and we went to see the movie Ghost when it came out. And she brought her cousin along because, she didn't know me didn't know what kind of guy I was, I could have been a axe murderer for all she knew. Well, anyway, we had a good time. We started dating, and she got pregnant, and we had a miscarriage. I say, because I was part of it. And way back then, they didn't tell you anything what to do. So they disposed of it, and we didn't know what to do. So we gave him a name, and we consider him one of our kids. But he's in heaven. So his name is Michael. Anyway, that's just a little backstory. But she has been great. You know, I'm hard to live with. Tough old guy, paramedic, grumpy sometimes. Get up and rah, 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 rah. And, you know, she deals with it. So she's going to get about a month break when I go in the hospital. And then I'm going to be a step carrier with her. 60 days minimum. Hopefully, I will do the thing and do the 60 days and be back to work, because she can't afford to lose her insurance, and I don't want that to happen. So yeah, they said the company, it's kind of like a third party. I'm not sure exactly how they got involved, but the transplant people called them or whatever. So they take your insurance and they cover everything. You don't have to worry about anything. The rejection medications, I don't have to worry about. The transplant, the cost of the transplant, I don't have to worry about. All this stuff has been approved, taken care of, as long as I am on Viva Healthcare and employed where I'm employed. They cover me for the first year. Anything to do with the transplant, they cover. So the reason I'm doing all these silly little updated videos and stuff, I started this YouTube channel, and I didn't really start it. I posted a few videos, and then YouTube kind of made the channel for me, and then I just started adding videos. But this whole, all these cancer videos, updates and stuff, I just want to be able to look back and see where I was and where I am in a year. So, you know, just you know, be patient with me. If there's a bunch of you know, silly stuff that is you know, repetitive or whatever, I just want to go back and be able to watch these videos a year from now. Yeah, that's my plan. But you guys, treat each other good. Be good to one another. Because, man, most of us, I never thought I would be sitting in the chair that I'm sitting in talking about pre-leukemia. Never occurred to me. As many people that have cancer in the United States, when things are going well, you know, your job is great, you're making money, you're not sick, you're doing stuff, you know, you don't think about it. You know, you're just for the next day. That's what you're headed for. And you know, you complain about having to go to work. I don't want to go to work today. You know, it's like, I don't feel good. You know, it's just whiny stuff. Man, be thankful you got a job. The position I'm in, I couldn't be in a better position for what is happening to me right now. I know this video is going on, and I'm sorry, but if I had been straight up on the ambulance, not working for UAB Hospital, I would be in, I'd be in a crap of a mess. So I've got a lot of sick time. It'll cover me for 2 or 3 months. And I've got a little policy that I pay for that'll cover me, you know, write me a check for 2 or 3 months. I've got money built up in a IRA account that actually came from the 401k that on the ambulance that I was working for, and I quit. Transferred all that money so I would have more control over it to an IRA account, or easier control. So I've got my sick time, money in the IRA account, the little insurance policy. I got all this stuff, and hopefully 2 or 3 months is all I'm going to need. You know, I do a sit down at a computer job where I work. So I'm not going to be doing a strenuous lifting people job or anything. So hopefully, with God's grace and God's mercy, I will be back to work by January. Yeah, and because I can't afford to not be at work. So, but think about that the next time you're out there and complaining about having to go to work. Be thankful you got a job. Be thankful you have the physical ability to go to work. Be thankful for your job. That's all I got. Peace out. Be good to one another. Love each other. Treat each other good. And, you know, give thanks to God for what you got. You know, there may be some atheists out there that don't believe in God. Well, He believes in you. And just remember, nothing did not come out of nothing. There was a higher, there had to be a creator. A house did not make itself. There was a designer. There was a builder. Somebody built that house. Well, somebody built the universe. God built the universe. You feel me? You hear what I'm saying? It didn't come out of nothing. Even if there was a big explosion, God made the explosion. Everything had a builder. The camera I'm using, it didn't appear by itself. It had a creator, it had a maker, it had a builder, you know, all this stuff. Well, I've meandered long enough, so I love y'all. I really do. Smash that like button and smash that subscribe button. You know, help me get this thing a little bigger. Man, it's really, really small. You know, I got about 138 subscribers, but you know, that's okay. It's okay. I'm not trying to make money off of YouTube. You know, I just want more people to see what you're seeing. Peace out. Love y'all. Bye.